just to start with a few key definitions, patient flows, well, the word flow is a bit of a challenging one, because if you're looking in chronic diseases, patient flows are actually a quantified picture of where the prevalent patient population is. So for example, you could have heart failure patients, CHF, you could have type 2 diabetes patients, and then you have a number of patients that you would see if you would take a picture of the marketplace, which you would then see in a patient flow. So that would be more of a picture, in fact. In acute diseases, however, there we typically see a quantified picture of the number of patients in a given stage during a particular time period. So for example, we could be counting the number of myocardial infarctions during a particular year, or the number of patients going through a particular stage of cancer, for example, treatments through a particular line during a particular year. So patient flows are a little different depending on the disease area that you're actually looking at. On the other hand, patient experience journeys, or patient journeys as some call them, they actually look at the steps a patient goes through in order to be diagnosed, treated, and at the end comply to a particular therapy. And we'll be looking at two examples of these here. For example, a chronic disease patient flow. You have a certain prevalence, maybe only 40% diagnosed, 60% of the patients not diagnosed, 80% of those diagnosed patients get treatment X, 20% get treatment Y. In an acute disease, you would have, for example, an incidence of, let's say, 10,000 patients, 5,000 of those tested on biomarker positivity, 4,000 of those being negative, and then, for example, 3,500 getting a first line of therapy, which would be chemo, surgery, and or radiation, and then maybe 2,000 of those surviving to get a second line of chemo. So you see a slight difference here in the fact that a chronic disease patient flow is more of a picture. Where are the patients? In acute diseases, the patient flow sees how many patients go through a specific stage of their disease during a particular time period. So the objective of patient flows for me can be twofold. One objective can be to develop strategy and develop tactics. And honestly, if the number of diagnosed patients, the percentage is 58, 60, or 62, that really doesn't matter that much. You don't need very precise market data to use patient flows for your strategy and tactics. What you do need, however, is a visually simple presentation to gain collective insight from the complete team or the complete SWOT, different functions. Some people use patient flows for forecasting. And that's a little different, because then, of course, you will need more precise market data. If you're not sure if there's 40 or 60% of the patient population diagnosed, well, it's going to be very hard, of course, to come up with precise forecasts. And in certain cases, you will need pretty complex patient flows in order to minimize forecast error, particularly in specialty case care where you have subpopulations. It might become a little bit unwieldy at a certain point in time. I honestly think that some companies overdo the forecasting part a little bit, probably as a result of an input of finance departments that want to do the best possible job. We'll be talking about using patient flows here for your strategy and tactical development plan. If we then look at a patient journey, the typical example I always take here is, for example, family members who will seek a primary care physician advice or their GP's advice following some weird behavior of one of their family members. The primary care physician will then not be completely certain of what drives this weird behavior, might refer the patient to a specialist at a certain point. A specialist might then establish, for example, a schizophrenia diagnosis for a patient. Then at a certain point, they might prescribe, for example, classic antipsychotics to calm down the patient, to avoid aggressive behavior, delusions, etc., and to avoid also any suicides which might happen. At a certain point in time, when the patient is under control, they might then switch also a patient to an atypical antipsychotic and even discharging the patient. And then hopefully we would then have family members who would assist the patient to achieve compliance. You see the difference between a patient flow, which is a picture, and a patient journey, which shows really the steps that patients go through step by step by step. There's obviously some correlation. If very few family members seek primary care physician advice, then also one would expect in the patient flow to have a large number of undiagnosed patients, of course. And what we do additionally to that in the patient journeys actually is to try to understand the perceptions, the beliefs, the behaviors, the pain points. For example, in step one, some family members might feel a bit uncomfortable taking their family member to a prescriber and then tell them about all these weird stories and all this aggressive behavior, etc. Also, patients who suffer schizophrenia might suffer symptoms one day and not at all the next day. So if you go to a primary care physician on the day they don't have symptoms, it's going to be very difficult. So that explains actually why you might get a lot of patients dropping out in the first step of the journey, which is to have a primary care physician suspect that there might be something wrong. And I think this is a tool which is very useful to try to understand not only the patient journey, but as we'll see in a few moments, also the various beliefs, behaviors of different stakeholders who are involved in this journey. And that we'll look at in a few moments. The objective of patient journey is at the macro level to try to make the pharma industry, which for very obvious reason has been focused on prescribers, regulators, payers, more sensitive to patients and patients' customer experience. At the micro level, of course, the idea is to identify pain points which require to be addressed in order to maximize patient outcomes at the end of the day.